Did you know that liver cancer is amongst the leading causes of cancer-related deaths worldwide? And primary liver cancer almost always develops in previously diseased or a damaged liver. That may be a little low to start with, but hello everyone, I am Dr. Prashant Bhangui from Medanta's liver team. Welcome to the Liver Show. Today, along with Dr. Soin, we are going to talk a little about liver cancer, its causes, possible symptoms, and the treatment modalities available. Welcome, Dr. Soin.
Thank you, Prashant, for having me on the Liver Show. It's great to be here.
Thank you. Let's start off by saying, do you think, or what's the current fact? Can we cure liver cancer, or is it like a death sentence?
Oh no, it's not a death sentence. Liver cancer can indeed be cured, provided it is detected, diagnosed early. Now let me actually take you through some details depending on the stage of liver cancer. In early liver cancer, which means if the cancer is 2.5 centimeter or less, and especially if there's only one lesion, then it can be cured even without surgery or transplantation by certain ablative therapies. Now, radiofrequency ablation, which means a needle which is introduced through the skin and the liver into the cancer, and then there is basically heat and current through it. So that, or microwave ablation, which is a similar principle. It's a machine, and then through the needle, energy is conveyed to the cancer. Now that small cancer can be cured by either MWA, microwave ablation, or RFA. If the lesion is bigger, let's say 4 to 5 centimeters, and single, or if there are two lesions close to each other, and the rest of the liver is relatively normally functioning, so the patient is not in liver failure, then they can undergo what's called liver resection. Now that's a surgery in which that lesion or two lesions are removed with a certain uninvolved, non-cancerous portion of the liver around them. And with that resectional surgery, again, 70 to 80% patients can be cured. Now let's go to the next stage where there may be 3 or 4 cancers, both sides of the liver, left side and the right side, or there may be a bigger tumor like 7, 8, 9 centimeters. In that particular case, liver transplantation is curative, provided the liver cancer hasn't spread outside of the liver or to the major blood vessels of the liver like portal vein or hepatic vein. But when it gets beyond that stage, then you need special protocols.
Thank you so much, Dr. Soin. I think that made things much clearer for us. As Dr. Soin said, using the various modalities, every year at Medanta, we treat more than 2,000 patients with liver cancer. And we've transplanted till date about 1,000 patients with liver cancer. And that's one of the biggest experiences in Asia and worldwide, of course. In addition to those criteria that Dr. Soin spelled out, that means that if you have lesser number of tumors and they are of a particular size, we've extended our criteria a little to benefit more patients who can be saved with this curative treatment of liver transplantation. So we transplant patients who have more locally advanced tumor in terms of number as well as in terms of size, and we're able to achieve a survival of more than 70% in them even at 5 years after their transplantation. Dr. Soin also spelled out that if you have a cancer that has spread to the local blood vessels in the liver, you cannot transplant them upfront. But we've devised a protocol and we've published this, and now the world is following us with these particular steps, where we're using a combination of radiotherapy, using focused radiotherapy, which is called SBRT, along with TARE, which is transarterial radioembolization, to treat the tumor thrombus in the vessels, and then transplant these patients after they are brought down to within transplant criteria. So that having said about the treatment modalities, Dr. Soin, can I ask you, is it even possible to prevent HCC or primary liver cancer as we typically call it, so that we don't even need these modalities to treat the cancer?
Yes, Prashant, that would be ideal. Prevention is always better than cure. And in this particular case, cancers can definitely be prevented or at least diagnosed early so that even if treatment is needed, they can be cured with the treatment. Now, if we understand that the four main causes of the liver going bad are alcoholic liver disease, non-alcoholic fatty liver disease, hepatitis B and hepatitis C, if these can be prevented, then the patient would not have a bad liver or a cirrhotic liver. And you've already mentioned that most of the liver cancers will arise in a liver that is already diseased or damaged. So one thing is to prevent the causative factors, that means viral hepatitis or fatty liver due to alcohol and other causes. But once the patient has developed cirrhosis, 25% of them will eventually develop liver cancer. So that means we know that this is a high risk group and they can be screened. What does that mean? It means that they have to have certain blood tests which are like tumor markers, which are called alpha-fetoprotein, it's a simple blood test, and PIVKA2, which is also another blood test. In addition, they can have an ultrasound of the abdomen. So alpha-fetoprotein measurement in the blood and ultrasound of the abdomen should be done every 3 months in any patient who has liver cirrhosis due to any reason. And if there is a suspicion of a lump or a lesion which is bigger than 1.5 to 2 centimeters on the scan, or if the alpha-fetoprotein rises beyond the normal level, then the next step is that they should have a CT scan or an MRI scan of the abdomen, specifically looking at the liver and the possible cancerous change. And that is how you diagnose liver cancer. So if you look at the high-risk group, keep screening them periodically, you will pick up cancers at an early stage, and we've already discussed how you can cure them.
Excellent. So what we are saying basically is that the bad liver gives an environment for tumors to grow.
Absolutely.
So if we could prevent the liver from going bad because of these various causes that you've enumerated, and today the treatment is available for these particular causes like hepatitis B, hepatitis C, and also prevention of progression of non-alcoholic fatty liver disease, and of course abstinence from alcohol, which is great to prevent progression of liver disease because of alcohol. We can actually prevent these tumors from actually affecting even those people who have a bad liver. And those who do have a bad liver which has progressed a little, you screen them regularly so that you pick the cancers early and then treat them accordingly.
Absolutely. That's the way to go.
Thank you, Dr. Soin, for those very enlightenment comments and your thoughts.
Thank you, Prashant. It was good to be on the Liver Show.
We hope our conversation on liver cancer was helpful. We want you to be healthy always. The Liver Show will be back with yet another aspect soon. Till then, please take good care of yourself and your loved ones.